Imagine walking into your doctor's office for a checkup. You sit down, the door opens, and your physician walks in.
Okay, standard procedure so far.
Right, but there's something strangely missing from the room. There isn't a single glowing screen anywhere.
Oh, wow.
Yeah, there is no tablet, no clunky laptop cart, no keyboard clicking furiously in the corner. Your doctor simply pulls up a chair, looks you directly in the eye, and, well, just listens.
I mean, in 2026, that almost sounds like a vintage luxury, like something from a completely bygone era of medicine.
It really does. But our mission today is to unpack a highly impactful article from Technology Review. This was featured in a recent AI News Digest from June 3, 2026, and it argues that this screen-free, purely conversational experience is exactly where we are heading.
Which is a bold claim, considering how tech-heavy medicine is right now.
Completely. And here's where it gets really interesting. The source claims that the only way we get back to that deeply human, completely present medical experience is by handing the keys over to a highly advanced, autonomous artificial intelligence.
It is a massive, almost unbelievable paradox, honestly.
Right.
Because we typically think of artificial intelligence, especially in highly personal spaces like medicine, as a force that brings, coldness.
Yeah, exactly. More automation usually equals more sterility.
Right. But the Technology Review article lays out a really comprehensive argument for why a specific technology called Agentic AI is uniquely positioned to do the exact opposite.
So it's not just making things more robotic.
Not at all. So today, we're going to explore the scope of this transformation. We will look at why the global healthcare system is fundamentally cracking under pressure right now.
And it really is cracking.
It is. And we'll look at what agentic AI actually is because, and I can't stress this enough, it is very different from the chatbots you might be used to.
Oh, totally different.
Yeah. And finally, we'll see how this technology promises to pull our medical infrastructure from a stressed, fragmented state into one that is profoundly efficient and, surprisingly, compassionate.
Okay, let's unpack this. Because before we can even begin to understand how an AI supposedly fixes a system as vast as global healthcare, we have to understand exactly why that system is breaking down in the first place.
Right. You have to look at the root causes.
Exactly. We have to diagnose the disease before we can talk about the cure.
I like that. And the source text diagnoses this disease by outlining a perfect storm of specific compounding pressures that are currently crushing the global healthcare sector.
It's not just one thing going wrong.
No, it starts with chronic underinvestment. We are talking about massive networks of hospitals and clinics trying to solve 21st century medical complexities using 20th century budgets and infrastructure.
So the foundation is already cracked. I mean, they simply do not have the financial resources to modernize or expand at the rate the population actually requires.
Exactly. And add to that cracked foundation the reality of strict hiring constraints.
Right, because even if a particular hospital manages to secure some capital, there are massive bottlenecks in bringing in new talent.
Huge bottlenecks. The pipeline for medical professionals, it takes a decade to produce a fully trained specialist.
And you've got regulations, budget caps, and honestly, a shrinking pool of willing candidates. That often prevents facilities from hiring the staff they desperately need just to cover the sheer volume of patients walking through the doors.
Right, which brings us to the most overwhelming pressure the article identifies: the ever-growing demand for medical services driven by an aging population.
It's a huge demographic shift. Let me try an analogy here. I like to think of the current healthcare system as a really struggling restaurant.
Okay, a struggling restaurant. Walk me through it.
So the kitchen is completely underfunded. That's the chronic underinvestment.
Right.
And management isn't allowed to hire more chefs. That's the strict hiring constraints. But busloads of hungry tourists just keep arriving at the front door.
And those tourists represent the aging population.
Exactly. And these aren't just tourists wanting a quick glass of water. Older patients naturally require much more complex, frequent, and specialized care.
Right. They don't just need a quick antibiotic.
Exactly. They are managing diabetes, heart conditions, and joint issues simultaneously. It's like every customer ordering a complex, customized 5-course meal.
That is a great analogy. So the demand is compounding exponentially, while the resources and the staff to treat them are functionally frozen.
Which means the waiters, or doctors and nurses, are completely burnt out, and the diners get a fragmented, terrible experience.
Spot on. When you synthesize these systemic pressures, the reality on the ground becomes quite grim. The source identifies two major fallouts.
Okay, what are they?
First, for the medical staff, it results in severe stress and absolute burnout. I mean, they're being asked to process an impossible amount of complex data and see an impossible number of patients every single day.
Which is just not sustainable.
No, not at all. And second, for the patients, it results in what the article terms fragmented access.
Fragmented access. Yeah, think about the last time you tried to navigate a complex medical issue. I mean, think about the endless phone tag, just trying to get a referral from your primary care doctor to a specialist.
Oh, it's a nightmare.
It is. And then think about finally showing up to that specialist only to find out they don't have the lab results from your other doctor. So you have to sit there and re-explain your entire medical history from scratch.
Which happens all the time.
Exactly. You get a piece of your care here, another piece months later over there, and nothing connects smoothly. That is the fragmented access the source is talking about. It feels less like a cohesive health journey and more like a bureaucratic obstacle course.
And the human cost of that fragmentation is immense. I mean, a missed message between two clinics isn't just an administrative error.
No, it could be life-threatening.
Exactly. It can mean a delayed cancer diagnosis or a dangerous drug interaction. The stakes are incredibly high here.
So we have this perfect storm.
Right. And since human hiring constraints and financial underinvestment are, well, they're fixed realities in many global systems right now.
We can't just fix them overnight.
Exactly. We cannot simply snap our fingers and spawn a million new doctors or perfectly funded hospitals. So the system requires an innovative way to bypass these bottlenecks entirely.
Which brings us to the heavy lifter of our deep dive, Agentic AI.
Yes. But to understand the proposed solution, we have to be very precise about what Agentic AI actually is.
Right, because the source makes a clear distinction between this and the older generations of artificial intelligence.
A huge distinction. This is not just a digital filing cabinet. It is not a basic algorithm that passively holds data or, flags a keyword in a chart.
And it is not even just a generative AI that writes an email when you ask it to.
Exactly. Agentic AI has, well, agency.
Agency, meaning it can act on its own.
Yes. It is a sophisticated form of artificial intelligence capable of handling complex, multi-step tasks autonomously. You give it a high-level goal, and it executes the necessary steps to achieve that goal without needing human prompting at every juncture.
Okay, let's ground this in a mechanism because handling complex tasks can sound a bit abstract.
Fair enough.
If the current broken healthcare system is a massive administrative traffic jam, going back to our earlier ideas, how does traditional software compare to agentic AI?
That's a good way to look at it. Think of traditional healthcare software as the traffic camera.
Okay, the camera.
Right. It simply monitors the situation and tells the doctor, hey, there's a backup here. You have 50 unread patient messages and 3 conflicting schedules. It just points out the problem.
It shows you the mess but doesn't clean it up.
Exactly. Now, generative AI, the tech we've seen booming over the last few years, is like the radio announcer. It sees the backup and suggests, here is an alternate route you could take, or it drafts a quick response for the doctor to send. But it still waits for the human to hit send or steer the car.
So it's helpful, but the human is still doing the driving.
Right. But agentic AI is the hyper-efficient traffic controller.
The traffic controller.
Yes. It doesn't just watch or suggest. It actively changes the red lights, physically reroutes the cars, contacts the other drivers, and clears the gridlock autonomously, all based on the overall goal of keeping traffic moving.
Wow. So in a hospital setting, the goal given to the agentic AI might be schedule a follow-up with a cardiologist for this patient.
Exactly.
And the AI autonomously checks the patient's availability, accesses the specialist's calendar, initiates the booking, sends the relevant lab work over to the new clinic, and follows up to ensure the appointment was kept.
Yes, all of that.
All without the doctor clicking a single button.
That is the exact mechanism of relief the source highlights. It takes over those crushing administrative duties and streamlines operational processes. It actively organizes, predicts, and executes the workflows that are currently burning out our medical professionals.
Okay, I am going to push back here.
Go for it.
Because playing the role of the skeptical learner, there is a phrase in the source text that gives me pause.
How's that?
The article specifically mentions that this agentic AI handles complex tasks and supports decision-making.
Right.
If I am an already stressed, burnt-out doctor, and now I have a highly advanced autonomous machine sitting next to me supporting my decision-making, suggesting diagnoses or treatment plans based on mountains of data, doesn't that actually add to my cognitive load?
That is a very valid concern.
I mean, now I have to spend my incredibly limited time auditing a machine. If the AI suggests a treatment path and I disagree, do I have to fight it? Am I liable? That sounds like a brand new layer of stress, not relief.
And that is probably the most critical hurdle in adopting this technology. If the AI creates a combative diagnostic environment, it fails.
Exactly.
However, the source text reconciles this by framing how the decision support actually functions in practice. The AI is not designed to override the doctor's clinical judgment.
Okay, so it's not playing doctor.
No, it does not act as an autonomous physician making final calls. The decision-making support is entirely focused on data synthesis.
I need a concrete example to really buy this. Paint the picture for me of how this actually lowers the cognitive load instead of adding to it.
Okay, consider an elderly patient who comes into the emergency room.
Right, ER scenario.
They have a primary care doctor, a cardiologist, an endocrinologist, and they've been to an urgent care clinic twice in the last month.
So their records are everywhere.
Exactly. Their medical records are scattered across 4 different, completely incompatible software systems. For a human doctor, piecing together that medical history takes hours of phone calls, faxing, and scrolling through hundreds of pages of disjointed notes.
Just to make sure they don't prescribe a medication that interacts poorly with something the cardiologist prescribed 3 weeks ago.
Right. And the doctor in the ER currently doesn't have hours.
They have minutes, if that.
Exactly. So here is where Agentic AI steps in. The AI is given the goal: prepare a comprehensive clinical summary for this incoming patient.
Okay.
Before the doctor even walks into the room, the AI has autonomously reached into those 4 different databases, extracted the relevant history, cross-referenced the current medications, and flagged a potential severe drug interaction based on recent lab results.
Wow.
It presents the doctor with a concise, synthesized dashboard. The AI didn't make the medical decision to treat the patient. It did the tedious, complex data collation. It cleared the desk so the physician could apply their human expertise to a clean set of facts instantly.
Ah, I see. So it is doing the exhaustive hunting and gathering of information.
Exactly.
The doctor isn't second-guessing a diagnosis generated by a machine. They are simply reviewing a perfectly organized dossier that would have otherwise taken them hours to compile.
Right. The relief isn't in replacing the doctor's brain. The relief is in the complete removal of the administrative friction.
That is a huge distinction.
It is. And if we connect this to the bigger picture, when you remove that friction at the level of the individual doctor, you start to see profound changes in the overall structure of the healthcare system.
How so?
Well, the Technology Review article makes a very strong pivot here. It states that because Agentic AI streamlines these processes so effectively, it holds the promise of bridging massive gaps in service provision,
Which leads to what?
to ensuring a more equitable and efficient healthcare system.
Equitable and efficient. Those are massive promises.
They really are.
Let's connect this micro-level data sorting to the macro-level impact. How exactly does an AI doing administrative work bridge gaps in service for a patient who is struggling to get care? How does this make the system fairer?
If we look closely at why healthcare is currently inequitable, it often comes down to the barrier to entry created by administrative bloat.
Okay, administrative float.
Yeah, when a system is bogged down by inefficiencies, when scheduling takes weeks, when referrals require hours of paperwork, when staff are too exhausted to follow up on complex cases, the system defaults to favoring a certain type of person.
Whoa.
Those who have the resources, the time, and the persistence to fight their way through the bureaucratic maze.
That makes total sense. If you are working 2 jobs, or you live in a rural area without easy access to multiple clinics, or you simply don't have the energy to spend 3 hours on hold arguing with insurance and scheduling departments, you simply fall through the cracks.
Exactly. The fragmented access we talked about earlier inherently punishes the most vulnerable patients.
Going back to our traffic analogy, the administrative gridlock means nobody gets anywhere, unless you have a VIP escort, maybe.
Right. But Agentic AI steps in as that hyper-efficient traffic controller
Right.
because it handles the complex routing, the data transferring between specialists, and the scheduling autonomously and instantly. The cost and time required to deliver care drop dramatically.
The roads are finally clear. And because the administrative traffic controller is keeping the lanes open, the ambulances, meaning the actual tangible medical care provided by the doctors and nurses, can bypass the gridlock and get straight to the patients who need them.
The efficiency of the machine translates directly into broader access for the human.
That's a great way to phrase it.
Yeah, think about it. When a clinic isn't spending 40% of its labor hours on paperwork and data entry, its capacity to actually see patients expands dramatically.
Without needing to hire a single new doctor.
Precisely. It lowers the barrier to entry. Care becomes more accessible and, theoretically, much more equitable across different populations.
Which brings us to the absolute core of this deep dive.
The main event.
Right. We have established that agentic AI can make the background operations vastly faster. We have established that by clearing the gridlock, it can make the system fairer and more accessible to you and me.
Yes.
But the most profound claim in this article isn't about speed, logistics, or even equity.
Yeah, it's not.
It is about the emotional and interpersonal quality of the care itself.
The concept of rehumanizing healthcare. It serves as the central, beating heart of the source material's argument.
So what does this all mean? I mean, rehumanizing is such a striking word choice because it carries a really heavy implication.
What implication is that?
It implies that right now, modern healthcare has been dehumanized.
And honestly, based on the compounding pressures of underinvestment and burnout we examined earlier, the reality is that the human element has been systematically stripped away.
It's hard to argue with that.
When a medical professional has 15 minutes allotted to see a patient, and 12 of those minutes are spent staring at a computer screen, frantically clicking boxes to satisfy the requirements of an electronic health record system, there's just no room for connection.
The transaction becomes cold.
Exactly. But the source argues that by automating the repetitive tasks and vastly improving operational efficiency, healthcare professionals are suddenly granted their most valuable, non-renewable resource back.
Time. It all comes down to time.
Yes, time. The text explicitly states that this newfound efficiency allows professionals to focus entirely on patient interaction and personalized care.
And this is not framed as a nice bonus or a fringe benefit, right?
No, it is presented as a fundamental shift in the quality and efficacy of medicine itself.
Because if you give a doctor their time back, they can finally look at the person sitting on the exam table.
They can actually be present.
Right. They don't have to listen to your symptoms while simultaneously trying to mentally navigate 3 different software menus. They can observe the subtle cues.
Those cues are so important.
They really are. They can notice that you look a little more fatigued than usual, or that your hands are shaking slightly, or that you seem unusually anxious about a particular treatment option.
And those subtle human observations are critical diagnostic tools that no machine can fully replicate. When a doctor has the time to communicate empathetically, it significantly enhances the patient experience.
The anxiety of the ticking clock is just removed from the exam room.
Exactly. And it directly impacts the medical outcomes, too. The source mentions that this shift makes healthcare both more compassionate and more effective.
Because if you feel heard, if you feel understood by your physician, you are infinitely more likely to trust them.
Right. Trust is everything.
You are more likely to actually follow the treatment plan, take the medication as prescribed, and report back honestly about your symptoms. Medicine goes from feeling like that rushed, burning assembly line back to a place of actual holistic healing.
It fundamentally alters the psychological dynamic of care. Technology and humanity are not positioned at odds with one another here.
No, they really aren't.
As the source beautifully articulates, they are working hand in hand. Agentic AI becomes the silent, hyper-competent partner operating entirely in the background, making the profound human connection in the foreground possible.
When you step back and look at the whole picture, the irony is just brilliant.
It really is.
In order to save the human soul of medicine, we have to rely on a highly advanced non-human machine. We have to give the AI all the robotic, cold, calculating, data-heavy work.
Precisely so that the humans can finally go back to being human.
It completely reframes how we should be thinking about the future of advanced technology in our lives. It's not about screens taking over. It's about screens doing the heavy lifting so we can finally look away from them.
I love that framing.
Let's synthesize this journey. We started by looking at a global healthcare system that is, frankly, buckling under the weight of aging populations, tight budgets, and hiring freezes.
The perfect storm.
Right. And the human cost of that storm is extreme burnout for doctors and fragmented, frustrating care for you. Then we introduced Agentic AI.
Not as a passive database and not as a generative chatbot.
Exactly, but as an autonomous administrative superhero, it acts as the ultimate traffic controller, clearing the gridlock, streamlining the data, and organizing the complex workflows without adding cognitive load to the physicians.
And we discovered that the ultimate overarching goal of all this advanced technology isn't just about saving money or boosting efficiency.
No, it is simply to give doctors and nurses the time to look you in the eye again, to rehumanize the entire medical experience.
And this matters profoundly to everyone listening, Because, well, regardless of your current health, eventually you will interact with this system.
We all do.
Yes, you will be the patient sitting on that exam table, or you will be sitting in the chair next to a loved one who is. And this technological shift toward agentic AI could dictate exactly what that experience feels like.
That's a really powerful point.
It could be the deciding factor in whether your future doctor has 5 rushed, deeply distracted minutes for you, or whether they have the time, the mental bandwidth, and the energy to truly listen and provide personalized, compassionate care.
It is the difference between feeling like a barcode moving through a scanner and feeling like a human being being cared for by another human being.
Exactly. And that leaves us with a fascinating implication to consider. A thought that pushes slightly beyond the source text, but builds directly upon its foundation.
Okay, let's hear it.
If we project this trend forward 10 or 20 years, if agentic AI successfully and permanently takes over the complex administrative work, the heavy data collation, and the vast memorization required for decision support, how will the fundamental training of a medical professional change?
Oh, wow. That completely flips the script on medical education.
Right. We currently design our medical schools to test heavily for rote memorization. We select candidates based on their ability to process massive amounts of data under extreme pressure.
Essentially testing their ability to act like computers.
Yes, exactly.
Readout.
But in a future where the actual computers handle the data synthesis perfectly, will the doctors and nurses of tomorrow be selected and trained differently?
That's a wild thought.
Will future medical schools spend less time testing biochemistry memorization and select their incoming classes almost entirely for their capacity for profound human empathy, active listening, and complex emotional intelligence?
Imagine a medical system where the most critical skill required to become a doctor isn't acting like a machine, but acting deeply, unapologetically human.
Because the machine finally has the cold, calculating stuff fully covered.
We started this deep dive talking about the fear of sterile rooms and glowing screens pushing us away from human connection. It turns out those invisible, autonomous systems running quietly in the background might be the exact things that allow your doctor to pull up a chair, hold your hand, and just listen.
It's a hopeful future.
It really is. Thanks for joining us for this deep dive. Keep asking questions, and we'll see you next time.